This is the first Wednesday webinar in ages, and the reason has been that CQC have been quite quiet, and they've been quite quiet because they've been doing a lot of stuff in the background. I'm not CQC bashing there, it's just the nature of the situation. But we've seen A, some kind of steady changes that we want to share with you here. B, I'm noticing even at the wonderful kind of Skills for Care and other events I'm going to, that there's such a wide range of experience and levels of understanding. I thought, actually, even if some people have heard some of these bits, there's going to be something new for everyone. So welcome. The plan is to go from 12:30 till 1. We should be done in that time. If people want to stay around and ask me anything or ping me an email, that's totally fine. So welcome. If this is your first webinar, the plan is to do these fortnightly. So we've already got a plan for what the session is going to be in 2 weeks' time, and I'll tell you what that's going to be about later on. We're going to cover a slightly wider range of topics over these next sets of webinars. So yes, we'll obviously focus on CQC things, but we're also going to be bringing in some other stuff around kind of CQC registered services and the situations they face. We're bringing some other people in as well, so it's not just my voice all the time, but we obviously will be predominantly focusing on our usual focus of kind of CQC changes, compliance, and getting ready for CQC. So the next slide I'm going to show you, some of you, this next slide could in theory be the whole talk. I could go on about what's on this next slide for the whole of the session, but I know that some of you in this virtual room will know all of this. Some of you will know some of you will know a bit. So I just want to recap the main changes that we know are being worked on so far. We know that there is an ongoing review of the single assessment framework, and we have some information in a few slides' time about dates and so on and so forth. Very exciting, if you're into that sort of thing. We also know that a key point of this assessment is to look at the reduction in the number of quality statements. This was one of the many recommendations by the CPA, the Care Provider Alliance, who suggested in their report, that was commissioned by CQC, that they should be reduced from 34 to 20. I always thought 34 was a pretty good shout because there's hundreds of Chloe prompts we previously had, and they got them down to 34. But I think as we've all been using the framework, as we've all been gathering and organising and labelling our evidence, we've started to see how some of those quality statements do overlap. And I think a really important point to raise when we think about the review of the single assessment framework, they're not turning around and going, do you know what, we don't care about meds anymore, or do you know what, we don't care about this anymore. What they're recognising is some of these quality statements actually cross over with each other, and they can be collapsed into a single quality statement. One I often give the example of is equity in experiences, and then there's another equity quality statement that actually together, around accessibility, actually together, they would make a good single equity related quality statement. So we know that there are some changes going on there. There is a look to return the named inspector. That's something that CQC have frequently mentioned out loud at all of their meetings. They have been very open about the fact that moving to these inspectors and assessors and local hubs, it's caused a bit of a mismatch. And there's a return to the idea of having a named inspector with sector-specific focus, and that's led to the introduction of new chief inspectors, including a chief inspector for adult social care, who I will mention in a moment. Again, inspections are moving back to looking at all quality statements. So those of you that had training with me ages ago, I talked about the tapas approach, a little snack here, a few quality statements here, a few quality statements there. That isn't the case anymore. CQC are openly stating that hasn't quite worked. People don't want to be half inspected. So CQC are now moving back to inspecting all quality statements when they inspect a service, not a little selection of some or a few. Since back in December, we have not had scoring at evidence category level, just at quality statements level. So you might remember they were scoring each individual evidence category between 1 and 4. They're no longer doing that. They're instead relying on professional judgment and scoring at quality statement level. That has led to CQC doing more work around how do we ensure professional judgment is at the level that it needs to be? How do we ensure that inspectors assess services as effectively, as fairly as possible? I've always said there is no such thing as a completely unbiased assessment process. Whether you're doing exams, which have biases because of people's personal capabilities, whether it's AI and computers that have all kinds of weird biases we are only just discovering, or whether it's in-person assessments, there is always going to be some form of bias. It's the nature of any type of assessment process. But what CQC are very aware of is the need to provide much more kind of training for inspectors to ensure that professional judgment process is A, fair, and B, I think a key word that we often talk about, traceable. And so there is some discussion around what that professional judgment piece looks like, so that when an inspector gives you a rating for a quality statement, it is clear and you understand where that's come from. If you wish to question it, you can. Another big thing that we are raising, that CQC are raising, or I said we, that CQC are raising and working on, is more sector-specific guidance. I've mentioned it, some of you will know, if you go all the way back to Halloween, 31st of October, CQC sent out a big document outlining what requires improvement: inadequate, outstanding, RI. Did that in a really weird order there, didn't I? Inadequate, RI, good, and outstanding. There we go. What those look like for each quality statement and for each key question. It was a massive document. It was quite helpful, if quite wordy. I think some services felt that because it wasn't sector specific, it was perhaps a bit broad, which I understand. CQC is working on sector specific guidance. We will have an adult social care sector specific guidance on what good, outstanding, RI and adequate look like for the quality statements for the key questions. Now, I can see there's 108 of you, 109 now, on this meeting. Some of you will have known all of that because CQC have been saying it at all of their meeting together meetings and their kind of one-to-ones and CQC Way events and all the things I've been sending out. Some of you will know this already. Some of you, this will be a big surprise. I'm going to give a quick 10-second run through it again, and then I'm going to go through some of the stuff that's come through literally over the last week or so. As we know, CQC are doing a review of the assessment framework. It includes a reduction in the quality statements. There is an aim to return the named inspector with sector-specific focus. Inspections are looking at all quality statements, not just a selection, certainly moving towards that. Scoring is only at quality statement level, not at evidence category level. And as a result, there is the return of professional judgment. And CQC is very aware of the need to ensure that inspectors are properly trained and supported, and they're reviewing that professional judgment approach so that any professional judgment that we receive is fair and traceable, and there is some more sector-specific guidance on its way. I mean, I always say that we work in school terms, so in my mind, we're heading towards September because it's summer around the corner. We're literally going to be in July in a few days' time, and that's when everything all kind of goes a bit awry. As I'm sure you know, within your own services, people book leave. So these are some of the macro changes that we have been aware of for many months. For some of you, it's new. For some of you, it's not. There have been some more recent changes. First of all, we can introduce Chris Badger, who is the new Chief Inspector of Adult Social Care and Integrated Care Services. So, Chief Inspectors were not necessarily organised against sector-specific areas. We do now have a range of Chief Inspectors that are sector-specific, and we have finally, bear in mind the first ones were, I don't know if elected is the right word, appointed, decreed, all the way back in February, I believe was one of the first ones. We now have our Adult Social Care and Integrated Care Services Chief Inspector, Chris Badger. It was announced on the 19th of June, so a week ago, and he will be starting in September. He's currently the Director of Adult Care Services for Hertfordshire County Council, so we know that he knows care, he is in that world, he knows local authorities, he knows the headaches of funding, he knows the joys of CQC, he knows the joys of the adult social care space that we are all working in. So personally, I am hopeful that this will be a positive appointment and it will lead to change. He replaces James Bullion, who was the interim chief. And as Sir Julian Hartley wrote in his commendation for Chris Badger, James Bullion was kind of thrust upon with this role, and has done his very best and weathered a very, very tricky time. So our thanks to James for all he has done. I think one of the important things around moving forward and Chris Badger being appointed is that it implies that we are starting to really move forward. Adult Social Care has been waiting for this appointment for some time. As we said, the Chief Inspector of Healthcare was appointed back in Feb we have one for us starting in September. It means that adult social care has more in place to start making actionable progress and moving forward. It's not that CQC have not been doing anything over this time. They've been working out a lot of things, working things through, a lot of stakeholder listening and so on and so forth. But it's hard to really push when you don't have a chief inspector that is solid and fully realised for the role. A little bit about Chris Badger in terms of what he said. He said, I'm honoured to be joining CQC as Chief Inspector of Adult Social Care and Integrated Care. I've seen firsthand the difference great adult social care can have on people's lives and the challenges that adult social care faces in this country. Ultimately, it's vitally important that people have access to timely and accurate information when making choices about who supports them. The care they receive should be highly personalised to their needs and aspirations. I look forward to meeting CQC colleagues and working together to improve both how we work and our role in wider reforms for adult social care. We can see here a focus here on making sure that assessments are accurate, that information available for people that informs their decision making, like CQC reports, like CQC inspections, like CQC data, are accurate. A focus here on person-centred care. And we also can hear the focus on getting involved in the wider sector reforms. There is some big stuff coming down the pipeline that will influence adult social care. And one of the things that I think as a sector we need to really think through is our voice as a group, the role of inspector bodies like CQC, the role of larger groups like NCF and your local regional coalitions, organisations, because there are some things on the horizon that adult social care will need to take quite a strong stand on. We'll talk about those in a moment. So we have a new chief of adult social care and integrated services starting in September. In short, things are moving forward. Now, another really interesting point that was made last week, in fact, by James Bullion, the platform, the portal, the magic of the IT. There's been independent reports. CQC have been very honest in owning what has gone wrong. Very interesting statement that was made last week. It's going to take about another year to fix IT. That was James Bullion at an event last week. Now, that's not exactly stop your watches to it by the 19th of June 2026, everything's going to be fixed. It's a reflection of the fact that the challenges with the portal, the challenges with the IT systems more generally are not something that we're going to have sorted by September. They're not something we're going to have sorted by Christmas. They're probably not even going to be something we have perfectly sorted by January. This doesn't mean that we are living in a paper world and there's no IT working, but certainly things like the portal that was kind of one of the centerpieces of the rollout of the framework is yet to be fully realised. Over this year, CQC brought back a lot of its previous IT systems. In short, CQC were told that the IT systems they were working on were potentially going to start to get a bit creaky. Let's do a whole new IT project. Unfortunately, that IT project hasn't worked, and they're now back using some of those IT systems and doing workarounds to ramp up inspection schedules to deal with some of the issues caused by the previous IT system. CQC's consensus and the outcome of some of the independent reports that were done is that the IT systems can be amended and fixed to deliver its original vision. So it's not a case of delete, start again. There is some significant work going on both with regards to the portal and with regards to the IT structures and frameworks within CQC to get the IT working as it was originally envisioned back in the end of 23, early 24, when it was intended to be rolled out. So we have a bit of a timeline there in terms of, the portal issue is not going to be solved by the new school year. It's not going to be solved by Christmas. It probably won't be solved in January, February. It's going to take about a year. So really, we've got this next year while CQC continue to use these kind of hybrids of IT systems. So hopefully that's a good initial. We've given you some of the main heads-up changes that we know about. We've given you some information around Chris Badger and how that's kind of moving CQC forward. There's also some indications of where we are with the platform. But the single biggest thing that came out last week as part of a CQC talk that was at the Care Innovation Summit were some timelines. Now, I use timelines in the broadest sense of the term. This is CQC. They don't like to put specific dates on things too early. These are text and quotes directly from a slide that was presented by James Bullion. I am going to put an image of the actual slide up that I took on my phone from way at the back of the theatre on LinkedIn, just so you can see. We haven't been making this up, and just so you can see it in its full glory. It's split up into 3 areas. First, June 2025. So right now, today, we have what was phrased co-design begins. We are gathering insights and shaping a model that reflects the varied experiences of care providers and puts the voices of people who both give and receive care at the centre. Yeah, we know, we've heard this for most of the year. We've heard this since the Julian Hartley, and it's a good thing to do. It's right that they're listening. It's right that it's being co-designed. One of the challenges of the 23-24 single assessment framework was it felt very much like it was done unto us, and it kept being tweaked, and sometimes quite majorly tweaked as it was being rolled out in a way that felt a little bit inconsistent, shall we say. So the co-design is ongoing. However, here's where it gets exciting. Again, even though we've made it look all lovely and care researchy, and shout out to my team for all of their wonderful IT, arty wizardry, every word here is exactly what was on this slide from CQC. Autumn 2025 formal consultation. This consultation will give all stakeholders the opportunity to test and refine our proposed approach, ensure it is inclusive, evidence-informed, and geared towards continuous improvement. You know, I've said before that people think in school terms. Well, September school term, that's when we start to test and refine the amended version of the single assessment framework, which means that really the other side of summer, we'll start to see what this amended, reviewed single assessment framework is going to look like. And then, I always talk in terms, don't I? 2026 and beyond. So we're thinking here essentially January, February and beyond. And again, those aren't our terms, those are their terms. Implementation and evolving through continuous improvement. Following consultation, the new assessment framework will begin to roll out. We will continue working together, learning from what's working, adjusting what isn't, and keeping pace with a changing sector. So what we're seeing here is we've got the ongoing co-design stuff. It's been talked about lots. We all know that CQC are listening and thinking through and working on things like the number of quality statements following the CPA review. And all of us have been sent, and I can't talk because I do it too, been sent surveys by CQC about how they should be doing it. Then we're moving towards this formal consultation where they want to kind of really present and we can test and refine the approach. So we go out of the kind of behind the iron curtain as they work it out to here's what we're thinking of doing. Let's have some responses. Let's get involved. And then the intention is 2026 and beyond. And I would like to think that's January, February. The first part of the fact that they've used autumn here implies it's the next term, as it were. That they will be looking at the assessment framework being rolled out. Notice begin to roll out, keeping pace with the changing care sector. They are openly stating that as part of that rollout, there will be ongoing tweaks, refinements, and listening. And I think that is a good thing. We just have to be, there is, on the one hand, we don't want things to just be kind of spearheaded and we're kind of left waiting. Equally, on the flip side, too many cooks can spoil the broth. If we try and create a framework that works for every single person, every single view, we will never get a framework. So it'll be interesting to see how this kind of judgment, assessment, continuous improvement approach works. So we have a bit of guidance, not hard dates, but we have a bit of guidance around the datings for the amended, reviewed, kind of enhanced, however you wish to call it, framework is going to start to take shape and be rolled out. You can see here 2026 and begin to roll out the new assessment framework. So I think that's big news. You can see why we decided to do a webinar based on that. Just a few other key areas to be aware of. These aren't necessarily CQC framework, but they're just some things we just want to kind of highlight as ongoing areas that will affect us as a sector. We have the Fair Pay Agreement for Adult Social Care. This was supposed to come out in May 2025. It still hasn't. It was part of Labour's election pledge. There is some information that we are awaiting to hear as a sector around the Fair Pay Agreement, what that will mean, what that will look like, what it will mean in terms of uplifts or not for council rates and so on and so forth. We also have the NHS 10-year plan. Again, was due to be published in spring, hasn't yet been published. There is some comment on some of the NHS 10-year plan websites. The information will come out in the coming weeks. So perhaps we'll hear something in the next 3 or 4 weeks. One of the key things in the NHS 10-year plan is what they call the 3 shifts, and 2 of them have a lot of implication for the adult social care sector. Number 1, moving care from hospitals to communities. That is obviously central to the role that adult social care plays. Making better use of technology, again, that's something that we're all doing. And then number 3, focusing on preventing sickness, not just treating it. Again, an emphasis here on some of the roles that adult social care can play in that. I think when we think about what this means for adult social care, again, last week, James William made a good point. He said the NHS plan is not a plan for social care, but it is a plan that won't work without social care. And again, that focus on community care, that focus on prevention really can't be realised without us. So I think it's an interesting opportunity for us in terms of responding as a sector to the Fair Pay Agreement, responding as a sector to the NHS 10-year plan, and thinking through how we can be part of the solution rather than kind of the sidestepped other sector alongside the NHS. So very quick summary. As we said, there are a number of key changes CQC are consistently raising and working through. We talked about, the change to the framework, the reduction of quality statements, the introduction of the named inspector, making sure that assessments are all quality statements, not just a part of them, and so on and so forth. We have a new Chief Inspector of Adult Social Care who will be starting in September, which really ramps up the speed at which our sector can start to be making changes. The platform, the portal, and other IT needs about another year to fix. There are plans to test the single assessment framework in autumn and launch from 2026. Now, that doesn't mean that it's going to be absolutely perfectly sorted and that it's going to be universal. We saw when they launched the framework back in 23, they did it in regions. They started, I believe, where I am, down in Kent, and it slowly crept up until March 24 that it was actually across England. So we know that CQC may wish to do something similar as they look to kind of further test and then launch from 2026 an amended version of the framework. The Fair Pay Agreement and the NHS 10-year plan are also looming. They have a huge impact on us as a sector. They also have a huge impact on CQC and what they are doing. So it is something that we as a sector need to try and keep abreast of, keep informed of, and try and create a reasonably unified voice. Speak to unions, speak to local local associations as well. In a couple of weeks' time, we're going to do another Wednesday webinar. It's going to be the 9th of July, 2 days before my birthday. How exciting. And it's going to be focusing on the National Care Service. What is meant by a National Care Service and how should the sector respond? This phrase, the National Care Service, has been bandied around. There are lots of different things that this could become, some which I think would be very good for the lives of those that receive care and support and for wonderful organisations that support them, some which could become quite complicated and perhaps the sector that we need to stand up to or at least challenge and question, as they might have a negative impact on people's lived experiences and on the organisations that support care. That's it for the official kind of part of the day. Just to let you know, obviously, if you have any training needs, we have our Care Staff Confidence course. If you have care staff that aren't quite ready to speak with CQC and answer CQC questions, we've got digital resources and we can do in-person training too. It's been going down very well. We also have our Get CQC Ready training. If you need training for your managers, your deputies, your team leaders, those kind of that are in those management positions that maybe they need to kind of have a bit of time to reflect on where CQC are at now and what that means for their service. Again, get in touch. We can help you with that. And of course, it wouldn't be us if I talk about our wonderful surveys. We do feedback surveys for all the people you support, residents, families, staff, partners. We can run that process for you, save you a headache, and hopefully give you some really great CQC ready evidence documents too. Do feel free to get in touch. There is a QR code if you want to scan and just kind of fill out a little form for us to get in touch. I am also going to share some links that you're welcome to use in the chat